My name is Kate Downing, and I'm a student at the School of Public Health in Public Health Administration and Policy, but also in Global Health. This semester I'm in finance, a couple of global health seminars, a medical sociology class, which I love, and I'm writing my thesis.
What I'd like to do is not do full presentations on your countries, but do like one issue or one reform issue or current salient issue that's going on in your country.
Working in North Minneapolis, I come in contact with a lot of those parents of the children who aren't enrolled. I do think that just because a service is available doesn't mean it's reaching the people it needs to reach. I have a graduate assistantship in the Student Services Center where I do recruitment initiatives. So I meet with students, I help to host information sessions. I get to be one of the first contacts that prospective students have. So that's really exciting to me as well. People come from all diverse backgrounds. So there isn't one path to public health. You don't do pre-med, you know what I mean? You don't do pre-public health. I lucked out in the assistantship that I got in student services. I just like talking to people about public health, and I like talking to people about research, and I like talking to people about the exciting things that are going on here because there are tons of them. I have another grant that I'm working on through the Center for Urban and Regional Affairs, and that grant is funding actually my thesis work, but also greater work for me on a project called the Prostitution Project through Falwell Center for Urban Initiatives in North Minneapolis, working on the creation of a sustainable drop-in space for women in prostitution. So we're about to cross into North Minneapolis. We're crossing over one of the main freeways. This neighborhood comprises a little bit less than an eighth of Minneapolis, but houses about 50% of the violent crime. Something like 1 in 45 houses residential houses is in foreclosure. It's pretty sad, but there are also a lot of really dedicated people working here, a lot of amazing individuals. My boss is one of them.
The primary goal of the project is to reduce the negative impact of prostitution in North Minneapolis.
In North Minneapolis, we find a really marginalized group of women who are doubly marginalized by their community, but also by society in general. So my hope is that working through public health on this prostitution project, which is an evaluative and needs assessment as well as an application of initiatives towards harm reduction and empowerment. The hope is that I'll be able to, lend my skills in public health, but also in management and administration, in order to, give these women a safe space to go and really be connected with services. What we want to happen for these women and basically. Well, it's interesting, but also I think that there's great injustices going on all around us every day, and I feel like it's, my responsibility to at least try to be a drop in the bucket. I know that you can't change people, and you really can't help people, and I really hate the word helping because, all these white people go in and they try to help. But I do believe that it's my responsibility as a citizen of the world to be at least a drop in the bucket.
I found her to be absolutely invaluable because I'm trained as an anthropologist, so my background is qualitative, and Kate brings a whole other piece that's critical to the project in terms of what the public health perspective can bring to working with people in prostitution.
Today I'm having a brunch for a bunch of people in my program and some friends. I don't know, hopefully it'll just be a chance for us to catch up. I just love what I'm doing right now. I love my classmates.
In my lifetime, I try only one time to smoke. At least I think. What's up?
Students try to quit for a month, and we give them free counseling, free patches and gum, and we actually have about over a 70% quit rate for the month.
That's amazing.
Yeah.
Have you assessed it to see whether they start again?
After a week, it does drop off a bit, and then we're doing a 6-month follow-up right now to see.
Cool.
So.
Coming here was, I think, the best thing I could do. I feel like I'm in the right place, and when you feel like you're in the right place, it just works. And professionally as well as academically, I feel like I found the right place, and I feel very, very fortunate about that. That said, I'm the busiest I have ever been.